I'm just going to dig right in. Who knows, in the list of infant mortality rates worldwide, who knows which country is ranked 18th? Think about it. Think about it. How many of you think the United States? It's Slovenia. We're ranked 44th. Okay? So I'm just going to go right into why this community and how this community is having an impact towards the UN Millennial Development Goals. I'm going to speak to you about the People's Health Clinic, which is working here locally, and then a little bit about the Hope Alliance and some partnerships working overseas. So the People's Health Clinic, you may know, takes care of residents in Sumner and Wasatch County who don't have health insurance. We here are very fortunate. We live in an affluent community. We live in a well-educated community, yet there are lots and lots of people who live here who do not have access to health care. They are either unemployed, or they're seasonal workers, or they're struggling working several part-time jobs. People's Health Clinic this year is going to see more than 6,000 patient visits. 6,000 visits of people who otherwise would not have access to health care. That number's been growing by probably a third every year. One of the critical areas of care that we provide is prenatal care. Goal 4 of the Millennial Development Goals is to reduce infant mortality. Goal 5 is to reduce maternal deaths. So I want to just have you imagine a scenario that you, sitting here, are a young married woman from Mexico. You work at one of the ski resorts, and you're pregnant with your first child. But you don't have insurance, and you don't have enough money to go to your prenatal visits. So your first prenatal visit is at the emergency room when you've started bleeding and have been having contractions. And you have a condition called Placenta Previa. That's when the placenta blocks the cervix, the opening to the birth canal. So when you have contractions, the baby's head just pushes into the placenta and it starts to bleed. You are driven to the emergency room by a friend in a panic. You're bleeding, you don't have a car, you get there, and unfortunately, tragically, it's too late because you've been bleeding for 30 minutes. So you and your baby don't survive. People's Health Clinic has seen several patients like this over our 10-year history and saved those lives because we've been able to identify that rare but existing condition. Now that's kind of a unique end of the spectrum sort of thing, but that's the kind of work that's being done right here in Park City to help save lives. We have kids here in Park City who go to bed hungry at night. We have kids here in Park City who can't read. We have kids here in Park City who don't have access to health care. So we here can make a difference. We can make an impact right here in our community. We don't have to go overseas, although I'll talk about that a little bit later. Mother Teresa is famous for many reasons. I love her for her quotes, one of which was, if you can't feed 100 people, feed just one. So that's what I'm here to implore you to do here in our community. Now, the scope here is clearly not anywhere near as great as it is overseas. So let me tell you about some partnerships that are occurring right now to do the same thing to reduce maternal deaths and infant mortality overseas. In one country where the Hope Alliance is a humanitarian organization that was started here in Park City, we go to various countries and do various things. One of the countries we're in is Guatemala, which has one of the highest infant mortality rates in the Western Hemisphere. The Izabal region in northeast Guatemala has an even higher rate within the country. So the Hope Alliance has been partnering with the Ministry of Health in Guatemala, with a local Guatemalan nonprofit called Raiche, and with various other groups to train midwives and provide supplies to those midwives so that they can take care of pregnant moms. Right now, the two Rotary clubs in Park City, the Park City Sunrise Club and the Park City Lunch Club, are partnering with other Rotary clubs in Utah, with the Puerto Barrios Club in Guatemala, to deliver an ambulance, to provide training for midwives, and to provide the medical supplies and equipment that they need to take care of the mothers and their babies. It's not just those Rotary groups, it's the Guatemalan nonprofits, Raiche, it's the Guatemalan Ministry of Health, it's the Puerto Barrios Volunteer Fire Department. It's a consortium and a collaboration of groups all working together. And I can't stress enough the synergy of partnerships in international aid work, international relief. We have so many groups in Utah, in Park City, in Salt Lake, working towards these goals, from churches to universities to nonprofits. My next plea for you is to help me figure out a way to get us all coordinated and working towards the same goals, on the same page. The last thing I'll just say is again, to just imagine if your neighbor across the street was going to bed hungry tonight, or you knew that they were sick with an easily preventable disease, or you knew that they were struggling to read and couldn't read, what would you do? Well, I think everyone here would want to help that person, and you would find a way to help that person. What we need to do as a community and globally is shift our thinking and realize that the single mother in Zambia who's struggling to keep her children alive is the same person as the neighbor across the street. So that's what I leave you with, and let's all make it happen. Thank you.